And with that, I'll turn it over to our presenter, Ruth.
Hi, guys. Here, let me start the slideshow real quick. Okay, so I'm really excited to talk with you guys today about incorporating movement and patient preferences into therapy. And we are going to be focusing on pediatrics. So just to go over some of the learner objectives today. So I want you guys to come away with practical patient preference ideas that you can use to assist with your therapy. And then also have practical movement-based activities to use. So I really want this to be a practical presentation for you guys. So that way you leave this presentation having ideas for your kids, having ideas of things you can try, questions you can ask, other things you can do to get your kids engaged and participating in therapy better. And so that is my goal. So that's why at the end, I will spend some time, like a good portion of time, actually going over some case studies, some practical case studies from my own work, as well as having you guys participate in a case study yourself. That way you're actually able to use some of these techniques and just integrate them right into your therapy. Okay, so here's the outline. So I'm going to introduce myself and the topic for a little bit, then we're going to go straight into the movement and patient preferences. So we'll do an overview of patient preferences and some different ideas with that, as well as an overview of just how to integrate movement into therapy. And then we'll spend a lot of time with the case studies, and then you will be able to put your own ideas out there, ask questions, so that this really is a collaborative process, and that you guys will be able to maybe have some ideas for some of those hard kids that you have, or the kids that you're just struggling with. And then we'll do a little bit of Q&A at the end. Okay, so a little bit about me and just the relevant disclosures that I need to do. So I'm a speech language pathologist. I'm employed with Mountain West Speech Services, which is a private outpatient pediatric clinic in Wyoming. I love it. I've been working there for 3 years. I'm receiving a stipend for this presentation, and I don't have any relevant non-financial relationships to disclose. So I've been a speech pathologist for 9 years, and I have experience in a variety of settings. So I've worked with adults and kids. Most of my experience has been working with pediatrics, and I love individuals of all disorders, but I really have a special interest in AAC, ADD, and autism. So those are like my the 3 things that I tend to like focus on and have a lot of my research and just personal experience with. And my passion is to really see individuals learn in a way that's respectful of them and their unique style and gifts. So that's why this topic is something that I'm so passionate about, because I really love being able to see those kids have that spark, understanding like, oh, this is why I'm going to work on this. This is why I'm doing this, and being able to learn in their own way. And I love seeing their personalities. Every kid is so different. And that's just part of the best part, I would say. Okay, so this is just my social media. If you want to like follow me on these things, I primarily am mostly on TikTok rather than my Instagram or anything, but you guys are welcome to find me on any of these platforms. Okay, so I want to hear a little bit and see where you guys primarily work, as well as like what age ranges you work with. It will just give me a good idea to also be able to share some more examples from my own experience, that I'll be able to maybe share some examples that will be a little bit more specific to the areas that you guys work in. So let me start this poll here. Awesome. Okay, let me start this poll. Okay, so first here, I want you guys to just answer what work setting you guys are in. And I'll give it a little bit of time to let all this come in. Okay, I'll just give it a little bit more time and then um, I'll end it so you guys can also see the results. Okay, here we go. Let me see. Okay. Looks like there's still a few more people answering. Okay, here. So you guys can see. So it looks like most of you guys are working in the schools, and then there's some of you guys work in outpatient home health, and then there's some that do mixed or other, and just a couple people looks like from the hospital. Okay, so that's helpful. So I've worked in outpatient for the past 3 years, but before that I was working in the school. So I'll be able to share some of the things that I remember doing and things that I've done in the past as well in the schools, and I'll try to, incorporate more of that into this presentation. Okay, so now let me go back. And then what age ranges do you guys work with? Okay, I'll give you a little bit more time and then we'll end this here in a second. Okay. There you go. So you guys should be able to see this too. So mostly in the school age range, which makes sense because that's where most of you guys are working. And there's some, looks like some in birth to 3. There's, a few you guys too that work with adults, young adults, and also just across the age span. Okay, so we have a nice variety, and I would say most of the people looks like work with school age kids. And that's primarily most of my experience too. Okay, let me stop sharing. Let me go back. Okay, and then awesome. Okay, so I want you guys to write a note to yourself. You can just jot it down or like put it in your phone, or even just kind of hold it in your brain. What are you most wanting to get out of this presentation? So you can even drop it in the chat. I want this to be something that you guys really are able to get what you want out of this presentation. So please write it down. And if you have any feedback from me at the end, I would love to hear it, or, throw it in the Q&A or the chat box. So I think sometimes it's great to have that reflection for yourself at the end, be like, okay, this is what I was expecting. This is what I wanted. This is what I wanted to get out of it. And, versus not. So, okay. So let me go back. Okay. So movement and patient preferences. Okay. So sometimes I like polarizing questions, okay? But to engage or to teach. Sometimes this is just a question I like to pose to myself. What am I going to do? Am I going to engage them or teach them? Now, obviously, we know that it's best to do both, but sometimes I just like to think about this, even sometimes when I'm going into a session of okay, what am I really trying to do today? Sometimes I think with some of those harder kids, here, I'll go to the next slide. So as a therapist, I'm not going to do the poll, I don't think, on this one. But I just want you to think about, as a therapist, what is your bend? So when you walk into a session, and I think this really depends on the kid that you're working with or the individual you're working with. Sometimes even, if you're working in the schools, you have groups. Think about just when you walk into a session, generally speaking, what is it that goes through your brain? Are you thinking how am I going to, what am I going to teach them today? Or how am I going to engage them? I think sometimes just as people, we tend to gravitate towards one side or the other, and it can give us good insights into maybe something that we, need to focus more of our energy on. But also I think when we have kids that maybe are just more difficult for us to figure out how to help them, or individuals, I think that sometimes we end up going more towards that engagement piece. So, okay, me, okay, let's go to the next one. Oops, there we go. Okay, so these are two questions that you could ask with any activity that you're doing with your kids. Is this engaging, and what is this teaching? So I think I like this just kind of simplified process for my brain when I'm thinking about something that I'm going to be doing with kids. Is like, okay, is this going to be engaging for them? Is it going to be interesting? Is it something that they really like doing, or is it somehow engaging them in some way? And then also, what is this actually teaching them? So sometimes we might be teaching them things that aren't their goals, or sometimes things are really engaging, but they're not really teaching them anything. And so it's how do we, really meld those two? Okay, so kind of another way of looking at this, and this is from the Sensory FLP. I don't know if you guys have seen this. It's from, it's called her language staircase. And I really like this because she does talk about those two pieces really. So the steps being those things that you need them to learn or want them to learn, or things that they need to learn. And that motivation piece at the top is really holding it all together. And so that's why I like those two questions that I just think about myself. Is this engaging, and then what is this teaching? So the teaching things are those little stair steps and those skills that they're learning, and then the engagement piece, I know she has that as part of like the bottom piece, but I like to think of that like motivation and engagement tend to be like, they tend to be very similar in my brain. So really, like, are they even engaged in it? Because if they're not, it's going to be so much harder for them to learn, or they won't. Because some people, it's like, if they're not motivated, if they're not engaged by that thing, you lost them, or if they're really, really motivated by it, but there's no stair steps of skills that they're learning, then in the end, like, okay, cool, that they love it, but there's really nothing that's like, there's no substance, there's no foundation. So you really need both of those two things together. Okay, so something about just like that question about, is this engaging to the child? So this is really a multifaceted thing. So it's not just, it's not so simple necessarily. So either, they can have that connection to you, and you are very engaging and motivating. So you can do pretty much anything. And because they have that connection to you, they're going to be interested. So sometimes even spending that time with things that they just really love, just to get that piece of them being engaged with you and being connected to you, you'll see that then later on, they're going to be way more interested and engaged in maybe anything that you have to present to them, simply because they have that connection to you. Or they can have a connection with whatever it is you're doing. And I would say a lot of times, like when you work in the schools, you might not have the luxury of being able to spend a lot of time like you may in outpatient settings, of being able to build that rapport with the kid. You might not have that when you work in the schools, and I understand that. And so then you may be looking more on like, okay, how can I give that connection and engagement to the specific thing that we're doing that's going to make it more interesting to them. So that's where you have all those patient preferred tasks and everything. So the other thing that can be engaging to kids is if it just meets a need. And if you guys just think about this for yourself, like there's going to be things that are motivating to you just because they meet a need, right? If you're hungry, it's going to be really motivating to go get something to eat just because you're hungry. Now, if you're not hungry, it's not going to be that interesting, right? Unless it's something that you really, really enjoy, like chocolate cake or something, then you might be really motivated by it. It doesn't matter if you're hungry or not. So, and then there's also going to be things that maybe you really love all the time. Like, okay, so for me, I love animal videos. I can pretty much watch for hours, specifically puppy videos and dog videos. I can watch them for so long, and it doesn't really matter. I'm always going to want to watch them because I think they're great. But there's other things that I may only be motivated by some of the time, like maybe going on a hike. Like, I love it, but if it's storming outside or if I'm not really feeling it, then I'm not going to want to go. So I think, realizing that, like, sometimes just reflecting on things in your own life and how you think about things can also help you as you're working with kids. Okay, so two things that you can do to really figure out those patient preferences. One is just observe. Okay, this is my favorite thing to do, to be honest. I know sometimes in the schools it can be a little bit harder um, to just sit back and watch how they interact. Even sometimes in a session, I'll just do this. Like if we're playing a game or something, I'll just sit back and I'm just going to watch them and see what they're doing, what it is, how are they moving, how much energy do they have, how much are they moving all over their chair. You can see what they like. Do they tend to be quieter? Do they tend to want to try to engage all the time? And you'll learn more from a few minutes of that, even that will help you engage them. And I think sometimes when we are therapists, we can go in and have this goal and we have this thing that we want to work on. And sometimes the best thing you can do is actually sit back and watch and just stop and just be and watch them and see what it is that they actually really like, because, or just who they are as a person, because that's going to help you as you work with them. You're going to have more, in essence, data, more information that you're going to be able to then use to work with them. So one of my kids, and I'll share this a little bit later on too, but one of my kids, we were working on vocabulary, and I was doing some of the traditional things, worksheets and these other things, and, different activities to help her learn. And it was sort of like pulling teeth. Not interested, she would do it because she, knew that was part of therapy, but it was just like, ugh, like, really, do I have to do this? Like, I understand. And so then it was just like through a process of things that happened, I realized that she actually really liked making videos. And so she would just make videos of me acting out these vocabulary words, which made me a bit of, I guess I got to do some of my theater skills, which I don't have. But it was just fun. So she thought it was hilarious. She thought it was great that she could just videotape me, video record me acting out these words, and then she would guess them. So sort of like charades. And she'd learn them so much faster that way. She would learn them in a couple weeks instead of, months, to be honest. And the other thing you can do is, if you are in the schools, and even if you're an outpatient, you can actually just inform parents, inform teachers, inform staff, even just that, hey, I'm just going to sit back and watch them. Sometimes it can be a little weird, but if you get into the hang of it, it's something that you really will learn a lot about your kids from. So the other thing you can do is ask questions. Those are the two things: you observe or you ask questions, and you do a bit of both. So you can ask specific preference questions. You can actually send home like a questionnaire for the family, especially when you're in the schools. I liked doing this because I felt like it gave me a lot of really good information off the bat without even sitting down with the kid. You can ask questions like this in the evaluation before they even come in. And then you can also ask questions about the observations you've made. So the kids tends to just play with themselves in the corner and just play with their own toys. Like, they're not really interested in anything else. You can be like, oh, like in a preschool setting, I'm thinking, you can ask the teacher, like, hey, is this normal for them? Is this what they usually do? Or are they tired today? You can ask some of those questions to figure out if this is just really who the kid is. So here's some questions that you guys got in that patient preference questionnaire. And there's a lot of stuff out there. Even if you just do some searches on the internet, on Google, you can figure out other questions that you might want to ask them. But you can ask them what kind of toys, what kind of shows, what videos. And I know a lot of times that's just very motivating for kids in this time. What foods do they like? Now, I am saying this one not to use it as a reinforcement. This is not for reinforcements it is in ABA. This is specifically meant as what are some foods that they like, so you can talk about those foods, or you can incorporate them into the activities talking about those things. You can incorporate them into what you're doing, not so you can use it as a reinforcer. You can even ask them what does a typical day look like for the kid, whether they're in the schools or home. And then this is something that you're probably going to look or learn more from observing, what preferences do they have with movement and sound and people and environment. And with people, okay, do they tend to just have that one person that they like to hang out with, or that they tend to be around? Do they have one friend, or do they just talk to one teacher? Is it going to be they're pretty social and they like to, they just seem to be okay with anyone and everyone. And then what do they do if they're told to sit in a chair? And this one is great. You really get a lot of information too about just if they tend to be more of a kid that's going to seek that input and seek movement and want to do things, or if they just are more of the kind that just likes to sit back and watch, because you have that too. So, okay. So let me go here. Okay, so let me actually show you this real quick. So I'm going to show you just the letter, and you would have gotten this in your handouts, but I'm going to show you here. Let me see. Stop share, and then I'm going to pull up I'm going to share something else. So see. There we go. I'm going to share something on my iPad so you guys can see the letter that I'm talking about. Might take me just a second here to pull it up. Okay, so this is something like you guys can change this. I think I sent it as a doc, so you can actually just modify it however you want. So this is something that I sent home when I was in the schools, and I was in like a self-contained classrooms mostly when I worked in the schools, but I got a lot of really good information to be able to just use and incorporate into my therapy. So like what you can ask them, like what things motivate your child, what brings out the best in them. And you might even find here, if you ask this question, that they're going to be able to kind of start sharing with you some of the things that are just really like positive reinforcement. Like if you're saying great job, or if you give some of that feedback, they might be like, hey, they really like that, or they just really like to move all the time. And if they're moving, that's when they, seem to be doing the best. And sometimes you'll actually see this when you send this home to parents. And then like what it comes to communication, what have you or others found to be helpful? What are you most concerned about? What information would be most helpful for you? So this is where you can get an idea of maybe if there's areas that the parent is interested in learning about for their kid, that they'll be able to share it with you. Okay, so yeah, so this is something, and you could change it, modify it. If there's other questions, or you send it home and you're like, I think I want to, do these other questions, you can always change it however you want to. But I just feel like it's a really helpful thing to be able to do. Okay, let me go back here. Okay, and then we'll go back to the slides here. Okay, so along with that, there's the other question. So we've been talking about like what's engaging for the kid, and then like just real briefly, I'll talk about what is this teaching. So I think that there's really like a few things that as therapists, I feel like we tend to go towards when we're even, just working on something with a kid is their goals, right? Number one, a lot of times we're like, okay, we've made these goals, we've been very specific with them. Or, they come in with this, they have an IEP with goals like this. And so we're like, we want to make sure that it's teaching them something related to these goals. It's working on these goals that we've set for them. The other things that we can be working on sometimes, and I think these are when maybe, we're not working on the goals in the moment, we might be working on just regulation, right? Emotional regulation, sensory regulation, whatever it is, to help them be regulated so that way they can work on those goals. And the other thing that we also work on is like life skills. So being able to advocate for themselves, like, hey, I need some help, or I don't know how to do this, or I need a break right now. You can be working on some of those things in therapy, even if it's not specifically their goals. And then also just ADLs. Okay, because especially if you work with kids with more complex needs, you're probably going to be doing a lot more of that than, maybe if you're just working on Artic or something. But I will say, so like, for example, like let's say you are, working with kids and they use a communication device, and maybe you're not working on specifically, having them use basic concepts or something. Let's say you've been working on basic concepts, so they've been labeling or, saying things are in or out or up or down or whatever. But maybe that day they're just having a really hard time. And so maybe all you're working on is just having them ask for squeezes. Maybe they know that, maybe they don't yet, but maybe that's all they can work on today is like, I just need to be able to, in essence, advocate for myself for this regulation thing that I need. Maybe it's not a specific goal, but in the end, you are teaching them something that's going to be valuable for them in the long run. Okay, So this is a little flow chart I made. So this is some of the additions that I made to the slides. So these are the updates. So it's just like a little flow chart that hopefully will help you guys like think through some of these things when you're thinking about your kids. So you can either like so the first thing you want to start out with, that's the patient preferences. You want to observe and ask questions. And then you want to, okay, what are the goals? What are the things that I'm going to be working on? What do I want to teach? And then how do I combine these creatively together? So for example, so let's say, so I'm going to show you a couple things that I've done with my kids. So let's say you have someone and one of their favorite characters is like Mickey Mouse Clubhouse, okay? And one of their goals is just like being able to label body parts and understand like the different parts of their body so that way they can actually communicate if they're hurting or if something's going on, they can actually communicate that. So that's one of the goals that you're working on, and something that you and parents have like talked about. And so combining these together. So, so with this kid, I was like, okay, what character matches what I'm trying to teach them? So I thought through like, okay, and I watched, they kept watching, and one of their favorite videos was this, goofbot video, and they just would watch this video over and over again. And I was like, oh, okay, perfect. Because this really matches, being able to like label body parts and stuff. I'm like, perfect. This matches exactly what it is that I'm trying to teach them. And the kid loves this adapted book that I made for them. Loves it because it matches something that they really love. And it also matches the goal that we're working on. Okay, so this one I'm going to show you guys. So another kid, so observing, just watching him, asking questions of the parents, like these are some of just the different shows and stuff they loved watching. Okay, and I know a lot of these examples are, maybe kids that are a little more complex, just because it tends to be a lot of like the kids that, I have to think a little bit more about like how to combine them. And then we'll go into some other different examples later with speech and stuff. So kid like Scooby-Doo, Minions, Loud House, like a lot of these like little cartoon characters, okay? And then we're working on feelings, being able to say like, I'm hungry, I'm sad, I'm mad, I'm all these things, okay? And so I was like thinking again, like what character matches what I'm trying to teach them, because I wanted to do a book. They really liked books. And so I thought about, okay, what character is going to match that? And I was thinking, you know what? If you think about Scooby-Doo, okay? So it was just like this, like, you could say stroke of brilliance or whatever that like popped into my brain. I was like, okay, Scooby-Doo like is so emotional, and he's almost like a human like dog, right? He's like totally demonstrates like his feelings, like if he's scared or sad or whatever. And like I bet you I can make a book that is going to match that. And so I'll actually show you guys this that I made for one of my kids. And like, actually, a lot of my kids love this book because they think it's funny, especially if they like Scooby-Doo. Okay, here, let me show you guys. Sorry, I gotta pull up my iPad again. Okay, go back. Okay, so Scooby-Doo. Okay, so the other thing that I do is if I am making a custom book, I will just say like I just am a little bit creative with this, and I really like to think about what is like something that the character would say, or how would they say it that's going to make it seem like it's almost them talking or something like related to them. So so this book I called like Scooby-Doo, How Do You Do? And I would read it like Scooby-Doo, how do you do? Like, how are you feeling? And so this one, it was like Scooby-Doo, how do you do? I'm tired, And there he is sleeping. There weren't really other pictures, so I just put a picture of a bed because that's what you wanted to do if you're tired. And then Scooby-Doo, how do you do? Oh, I'm hungry. And there he is, like eating the sandwich, which, and then these different things that, some of my kids like to eat, and you could really just customize this however you want. How I make them though is I literally just snip the pictures from Google and put them in there, or save them to my iPad and then insert them. It's a little easier to do snip and paste, but if you're on your computer. Okay, and then this one, like Scooby Scooby Doo, how do you do? I'm scared, and he's like jumping on Shaggy and like running away scared. Um, and then goes on through different feelings. So this is something that this kid absolutely loved it, and then a lot of my other kids who were also working on some of those same things really loved it, and then they started actually using those words when they were feeling that way. So it's a way to match something that they are really motivated by with something that you're trying to teach them that maybe that's not as concrete for them. Okay, and then let me go back. Sorry, lots of back and forth between my iPad and the screen. Okay. And then, okay, another one. So like Sesame Street, random videos, like some Minions. And then, okay, working on body parts, a different kid. And I was thinking, okay, what character matches? Again, like how am I going to motivate them to want to learn these body parts when they're just not really that interested in them? So I made a book, and it's called Elmo's Body, and it's so cute. And again, like when it's super motivating like this, it matches a character, they tend to like really love this. And thing is, these books, it might feel like it's overwhelming, but you can always just save them on your iPad or something and just pull them up on your iPad if you don't want to print them and laminate them. But like it, just a little bit of time, maybe 10 minutes or something to make one of these books, and it will literally keep your kids engaged for like weeks, honestly. And they think it's hilarious. Okay. Okay, so another one, I just took it from Google. So it's called Elmo's Body. And then I just said, like, where's Elmo's hand? Where's Elmo's other hand? Again, it's that like something that you might hear him say. So I just went through and circled with a little drawing pencil, and I just circled the different body parts and wrote underneath like the questions. So let me see. Okay. So, and okay, I will just say I really love making custom books, okay? I really love it. It's like my favorite thing to do for kids because I feel like a lot of times it can get that literacy piece in for them. It's something that's not a video, but it's also something that is using something that they love. And then you'll actually, like I said, kids actually just like love this. So some of my kids, when I read this book to them, I like just like I've actually like tickled their head, or and they think it's funny, so I'm incorporating that, the book with themselves, like them, and or like other kids just want to point, and you could even do this without the circles, so that is more of a test, but this is not, it's just meant to teach them, so that's why I have it all circled. Okay, let's go back here. Okay, so this is a slide that you guys have. So that's the patient preferences with those goals that they have. So that question, like you guys can even think of that, like, okay, what character do they love that matches what I'm trying to teach them? And so it can just really help you if you're like struggling with a kid, especially with like certain concept or something, and you're like, okay, how am I going to do this? Try and match a character and then try to maybe match some of the language or something that they're going to be saying with what you're trying to teach them. And especially if you have like gestalt language processors, like kids with autism or something, this is going to really help them. Okay, and then this is what I mentioned earlier, like someone, one of my kids liked talking, making videos, she liked the iPad, and we were working on vocab and memory. So I just combined them so that she would actually make videos of me doing like random charades of these vocabulary words. Okay, so this quote I like, I saw it a while back when I was like on a walk on like a stone or something. It was interesting. So, tell me and I forget, teach me and I remember, and involve me and I learn. So involving them is really involving them, their interests, even movement, like whatever it is, it's really engaging them. It's not just teaching them it, you're engaging them in it, and then they're going to learn. And honestly, they learn faster and it's more fun for them. Okay, so now teaching with movement. And I did see that one of you guys talked about like even how do you do this with telehealth. And so I'll try to, I'll try to see if I can think of some examples with that. Um, so this is really how to incorporate that movement with your kids. Okay, so just in general, so this is just a little bit about like that, the research and stuff. It helps with increasing engagement. So even just moving is motivating for kids a lot of times, even if they're not necessarily like it's just motivating to move, right? It's motivating to swing, it's motivating to go down the slide, it's motivating to just get up and walk around, even like with older kids. And there's so much research that shows that movement helps kids learn. So elementary school kids, university students, even just getting them to like get up and take a break for a second and come back, like they actually were able to concentrate better. They had more learners, they enjoyed things. Like even specific to speech and language, there's research. Kids with autism spectrum disorder, they were noticing that movement and speech and language were integrate, like connected. They had a reciprocal relationship. You have more of one and you're going to have more of the other. And they noticed that even with adults with neurological differences. So being able to incorporate movement is huge for kids, okay? And you can do this in groups. And so I'll talk about maybe how you can even do that with some of your kids that you might be seeing in the schools. Okay, so the way that I like to break up movement and how I like to think about it, like a little framework that I made is like either like movement is the activity itself, movement can assist with it, or you take movement breaks. And all of these are going to depend on what kind of kid you're working with. So we're going to talk a little bit about movement and speech, and then we're going to go into movement and language, and then we'll do the case studies. So movement as the activity. So speech itself is movement, like you're actually physically moving your, mouth, your articulators. And so let me show you this other little book that I made for one of my kids to teach them some of that, specifically the movement to make a vowel sound. So this was someone who was a little bit, so one of my non-speaking kids, but was like interested in trying to talk. And so we were working on it. Okay. Let me show you. Okay, so it's called My Scary Book. And so I've started working on like basically just how to make those different vowels. And so I started with ah because it was one that he could do, but he couldn't do it all the time unless it was like imitated. So I put different things that like you might be scared of, and then or just people in general might be scared of. And for me, it's mostly scary animals. So and they just think it's funny to like scare the teacher. Okay, so it's like a snake, and then ah. Okay, so and this emphasizes that movement that you're going to make, right? Your ah, the open mouth posture that you have with speech. I know. So I just like books. Okay, so that's and then you have all these different animals of ah, same thing. Ah. Okay, so that's emphasizing that movement and specifically that movement of the articulators for the for that sound. Okay, so movement is so that speech itself is the movement. Okay, and then assisting or facilitating speech. So using movement. So that can be tactile cues. So and I know like I use this with one of my kids who was like doing telehealth. Being able, like when making the S sound using the tactile cue, like in this case, we did like the one up, like his arms spider, even just being able to do that helped him be engaged. And it wasn't his whole body, but it was, at least something, some kind of movement. You have them move their body as they say the word. So like even taking steps with each word that they say, whether it's like, let's say you're working on just a sound, even you could be doing like, as they're walking or jumping on dots. I've done this or papers. Okay. Like if you don't have dots because you don't have dots, but maybe you have papers. If you're an in-home therapist, laminate some paper sheets, put them on the floor, or just put the papers on the floor and then just have them step on each one. Or even, if you're trying to teach them S sound and they go t, 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 t. Okay, even just giving their whole body that movement, or maybe they jump on the dots and then when they get to the end, then they're going to be saying the sound or the word or whatever it is. when they get to the finish line. So something else that can be helpful, just even riding a scooter. So I've had many of my kids doing this. It might be a little bit trickier if you're in the schools because, you might not have that opportunity, but maybe if you're on the playground, which would be kind of a weird place to do therapy, but you can. It might depend on the schools that you're in, but like riding a scooter, shouting out the words or whatever sounds that they're working on, literally just they're moving, but they're saying the sounds and saying the words. And it might look, a little bit more like it's not like normal teaching, but goodness, I've had kids that have done like 200 productions of whatever sound or word that they're working on, and they're so proud of themselves. And literally the entire time, they're just like riding a scooter around and running around. And just that's all they're doing. But I'm like telling them, like, hey, I got my clicker, and I'm going to see how many you can do. And I give them little, cues as they need it. Shooting a Nerf gun, obviously, this depends what setting you're into. But like just being like, I got it, every time they got it, or like, bam, whatever it is, whatever sound you're working on, you can actually like incorporate it with this. Hide and seek, another one of my kids. We would play hide and seek. You can even do this in a room, hide something and be like, I found you, put little animals around the room, and then be like, I found you, and then have them practice it 5 times to get more of the repetition in. You can even have them swing or something. If you do big sensory movement as they're working on their sounds, it can actually facilitate that production. Okay, and then movement breaks. So that would be you just like jump until your body feels calm and then sit down and then practice the sounds, or like jump for a minute and then sit down and practice your sounds and then get back up and jump. You practice a word, race down the hallway, practice another word for however many repetitions, or ride a lap, or race, right? If you have a few kids and be like, okay, let's all say our sounds and then we're going to race to the door, or, something like that, that's getting them that movement as they're working. Okay, so now movement and language. So movement as the activity for language, like it's actually what you're doing. So swing, 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 right? And you could be working on some of those core words or things that go, stop, eat. Like those are things that like I've seen, whether it's little preschoolers or maybe older kids who have a variety of disabilities, you can actually be working on some of those core words, and that's the activity. So movement facilitating it. This is where, you could have them sort items and then label the category. You can actually walk to go say hi to your peers. Like this is going to have that natural movement, and it's helping them actually be engaged with it. Use a wiggle cushion. I love those things. They're so awesome. Use a wiggle cushion while you're doing any kind of like language activity. You can even do it while you're doing speech. They're just sitting on it, so it gives them that movement, kind of like how we sometimes, like to move even, and you probably have seen me moving as I've been presenting too, right? It's just a natural way to keep myself regulated, to keep the kid regulated, and so that they're able to do whatever activity. Fidgets. Okay, so I am going to share a little bit of something. So it's that kind of an idea of something that I've been thinking about. So fidget toys, I think that's something that like there's maybe a little bit of controversy with that about like, should they be having a fidget while they're in speech therapy or while they're working on something? Maybe I can use it as like a reinforcer. They can have it when they're done. But here's the thing about fidgets. There's a reason why the kids are using them. Like, and even sometimes like, I don't know, how many of you would like take your pen and just do this, like when you were in school, like in grad school. I remember just doing this. It was a way that I actually helped my body stay regulated so my brain could focus. So in essence, something has to be moving, right? And if it's not your body, then it's your brain. So this is the way, this is just something that came to me earlier with one of my kids in particular. So it's like they are constantly doing this, okay, with a little toy. And if you take the toy away from them, they are not okay. They're not regulated at all. But if they have the toy, if they have the thing, they're able to stay engaged in the activity that you have. Because the thing is, it's like their brain is bouncing, okay? If you take away their fidget, now suddenly their brain is bouncing. Their brain is getting the movement. I mean, not like their brain is actually bouncing, but this is just how I think of it. It's like now their brain is bouncing, so their brain can't focus. But if you give them the thing, to be able to fidget with. Now all that energy, in essence, all that energy is going into their hand, and then their brain is able to actually stay focused. And also sometimes it's actually like if they're moving, it's going to have that blood flow is going to be increased to the brain, and they're actually going to be able to focus better. And it's just the way things are. Okay, it's just how it works. Just how it goes. You can have them swing while you read a book, or whatever other activity you have. You can have them just be doing a bigger movement activity and while you're working on something else. Okay, and then of course you can do movement breaks. Okay, so okay, I can't present without talking about feelings because I did do an extra year of coursework in mental health counseling. And so I always just, it inevitably finds its way into my presentations. Okay, so don't be afraid to talk about this with kids. Okay, it is literally a game changer. So I have had this happen so many times now with my kids, like literally just commenting on what they're doing. Like, okay, you seem like your body's going all over the place right now. How are you feeling? And a lot of times they'll actually just tell you, you can ask them, what does your body need right now? Because they're literally just like going all over the place. And sometimes even just labeling it for them and being like, hey, you're doing this, what's going on? And you're just saying it to ask them because you actually genuinely are like, I know you need something, but maybe I don't know what you need. They might be like, I just need a break. It's like, oh, okay. But sometimes you have to invite them into that. Or like even sometimes if they're really avoiding something, they have a lot of that avoidant behavior. Like, you seem like you don't want to work on this right now. What's going on? Is it hard? Do you need a break? What does your body need right now? Or like, do you feel embarrassed about something? Sometimes it can be like one of my kids was really struggling in a session and was just like, I was like, oh, wow. Okay. I don't know what to do because they were not working on the words. They would not focus. They would not try to say their words. They would not do any of that. And so I was like, okay, what's going on? I was like, you're having a really hard time working on your sounds today. And they had just been bullied recently at school because they had a hard time making their sounds and they were being made fun of. And so it's like, then we talked about it, and then we came up with a different plan and did some other things in the meantime to be able to just get some of that frustration out and also just have this kid feel more okay with, with things, and so I think that sometimes, we can see these behaviors or things that the kid's doing and we just forget that sometimes actually could just literally be they're feeling something and we have to just acknowledge it, and then they're going to be able to actually move on and actually be able to engage. So sometimes the best thing you can do is literally ask them what they need or tell them what you see, especially with older kids, even littler kids, even 3 or 4-year-olds. You can literally just be like, hey, I see this. What do you need right now? And you'll be surprised, honestly. It could have been that they watched something scary. You talk about it, and then maybe they need to move again, and then they're done. They get that energy out of their body, and then they're able to like focus. Could be it's too hard. Some reason why they're even having that movement. Maybe they just really need to move. And even okay, so for telehealth, even if you have a kid, depending on the kid, you could even just have them literally just jump up and down. Like just be like, okay, you really need to move right now. Let's just jump. And maybe you're even having them jump as they say the words, which is harder sometimes actually, but maybe that's what they need to actually just be able to get that movement in. Have them race to the other side of the room if they're in the house, have them just race. So like, say your words, I'm going to count down and now go run and then come back, so you can be able to do those different things. I've done that with some of my kids, like we practice the sounds and then I'm like, okay, go run to the door and come back, or, just so they can have that movement. Okay, if you do talk about feelings, you will get buy-in. You will get their input about what's going on. You'll get their thoughts, and then you can customize your plan. Maybe you need to take a detour and you need to talk about feelings about the sounds. Maybe you need to take a detour and talk about how hard it is and that they're working so hard and that you're really proud of them. Like maybe you need that, and it's going to have that connection piece with the kid, help them regulate. And at the end of the day, that's going to be how they're going to learn the best, and it is involving them. Okay. So let's move on to the case studies. So I know we took a little bit longer with going through this But that's okay. So I'm going to share my screen here and I'm just going to talk a little bit about like this problem solving sheet that I gave you guys. Let me share this real quick. And then I want you guys to, then I'll have you guys participate. Okay, so let me mirror this. Okay, so let's do the language one. So I'm gonna do this first. So this is like a little problem solving sheet that I gave you guys, and then I want you guys to actually use it for one of your kids or a couple of your kids. So it's kind of laying out like that flow chart. It's just in a Word document so that way you can actually use it a little bit easier. Okay, so what do you know about the kid? So I used my little Apple Pencil, so handwriting is really great. So like, what do I know about this kid? So they tire easily, they have limited body movement, they enjoy boo and hide and seek, they like nursery rhymes, they like some of those like simple songs. And what I'm trying to teach them is just increasing communication, okay? In any way, really engagement, and then maybe using some AAC of some kind, okay? Do I need to incorporate movement? Well, they really can't move that much, but they really like it watching me move. So they find that very engaging. Also, kids find that engaging with telehealth too. If you're doing silly things. I'm going to go find these things. I think it's funny. Okay, so how can I engage them? So I'm going to do hide and seek where I'm going and hiding and then I'm popping out and saying boo at them, like counting down, singing, dancing. Like I'll put on a song and I'll dance, right? And then they can choose the song and that can be actually how they're going to be communicating. So my thought is like, okay, I'm going to try some some AAC with them. I'm going to use partner assisted scanning, which means that like I'm going to have them use facial expressions to communicate that yes, no response. So if they really like something and if you're telling them and they really want it, they'll smile really big. So I have a couple kids like this and they'll give you a really big smile and like lean forward. It's something that they like. And so literally just having some choices. Some songs tend to put them in the same order because that's really that partner assisted scanning. You don't want to constantly be changing the order of things. Like, do you want to sing Old MacDonald Had a Farm? And then see what, if they smile or not. And then, do you want to sing Twinkle, Twinkle, Little Star? Do you want to sing Rain, Rain, Go Away? This kid loves it when I sing Rain, Rain, Go Away because I dance and they think it's really funny and they just enjoy it. Or, you can give them choices and not even do like saying, you can be like, do you want to sing? Do you want to do hide and go seek? Do you want to play with, maybe one of their favorite toys? And then see when they give a yes response. And this kid in particular will totally do that, and if they're not really interested in anything, they'll just give me like responses for all of them. And sometimes I think, I was actually talking with someone this week, is sometimes I think that kids may not give you like a clear no response because maybe it's just like, like, kind of how we're like, I don't really want to do that. We're not like, no, never. I don't want to do that. We're just kind of like, meh. So maybe that's what they're doing. Okay, so I want to give you guys time to be able to do this, okay, for your kids. So I'm going to pull up this problem solving sheet, okay? And I want you guys to all think of one kid. So if you have this, I want you guys to pull it up. And I think there is a link in the chat so you can see that. I want you to think just like if you have that one kid or a couple kids that you're like, I'm not really sure what to do with them. Okay. I want you to jot down real quick. I want you to jot down like, what do you know about the kid? What are things, preferences, observations that you've made of this kid? What are some things? And I want you to just jot down a few things, kind of like I did with my language kid. And then I want you to like jot down like what you're trying to teach. Okay, it looks like some people are raising their hand. If you guys have, I know I see you guys raising your hand. If you have any like questions or something, like feel free to throw them in the Q&A or put them, Or even if you just have something you want to say, if you want to throw it in the chat too, you can. Let me just make sure. Okay. Okay, and then I want you to just think about like, okay, do I need to incorporate movement with this kid? So if you notice that they're tending to move a lot and you're going to need to incorporate some movement, you might want to do movement being the activity or movement assisting with it. Because generally speaking, if a kid's moving a lot, that's what you're going to need to do. If you have a kid that maybe is just sometimes having a hard time sitting still, you might just need to do movement breaks where you do something and then you move and then come back to whatever it is you're doing. Okay, so, and then I want you guys to just write down like, how are you going to engage this kid given what you know? How are you going to engage them? And a lot of times it's going to be very specific to the things that you know about the kid, like those preferences that they have. And then like at the bottom here, you guys can just like write down some of your ideas. So what I'm thinking I want to do is I want you guys to like actually throw in the chat box. So if you have a kid that you're like, okay, I need help. Okay. So if you're thinking I know some things about this kid, I know what I'm trying to teach them, and I like not really sure how to engage them. Okay. I know stuff about them, I know what they like, and I know what I'm trying to teach, but I'm really struggling with engaging them. I want you guys to actually throw in the chat box. So write something like this. Okay. Like I have a kid who's working on, let's see here. I'll put something in the chat box so you guys can know. So like I have a kid who is working on R's, and they like running and moving and making videos. How can I engage them? How can I, combine these things? If you're having a hard time coming up with ideas, and that way me and other participants can jump on and actually say how it is you can help combine these things for them. How can you, okay, so I want you guys, and you can put it in the Q&A, either one. Let me see. I'll throw this in the chat so you can just see. It hasn't been like. Okay, awesome. Okay, student who's working on basic engagement, basic concept, loves books and farm animals. Perseverating on a Pete the Cat farm book. He only wants the book. Okay, yeah, I've had kids like this too. I would say like, so he loves book and farm animals. Is there something about Pete the cat that he's like really interested in? Because it's interesting that he's not engaging in other farm games and activities. He only wants that one book. I would say maybe is there something about Pete the cat that he really likes? Maybe see if you could do Pete the cat with something else. Maybe do Pete the cat with basic concepts or something. Maybe put the Pete the cat like like put a chair or a table, or like a chair, and put Pete the cat like on in and around and on it. You could even do like a little book. But that's my thought, is that there's something about Pete the cat that he like really likes. And so I don't know if it's like the wording of it or if it's just that character that he really likes. You could try using that character with other things, because it's possible that's why he's getting so stuck on it. Oh yeah. Working on K and loves playing the kitchen. Let me think about that. So you could try even like, if the kid's like having a hard time and tends to just give up. I'm trying to think what I've done with some of my kids who are working on K. You could even do like you're cutting, like and just work on just that like sound in isolation if that's what you're working on, just like so it's like, so you're using that motion of like cutting like vegetables or something. I'm like picturing like those little vegetables, like the Melissa ones that you can cut into pieces. Um, and maybe do that to be able to practice and maybe even talk to him and just talk to him about like, that sounds really hard, isn't it? Or like, maybe get out some of his frustration about that sound and even making it wrong. Like just to get out some of that frustration about that sound. It's not peep cat. Okay. He only wants the book. Mm-hmm. Yeah, I like that. Mm. Mm-hmm. Oh yeah, I'm saying that he's done with that. Yeah. Oh, I like it. I like you guys like putting all these different examples. Yeah, you guys have some really great ideas too. Show this a little bit bigger. Okay. Mm-hmm. Oh, interesting. Yeah, big movement. So Stacy, you were saying that it seems when big movements are included, she'll begin to engage verbally and talk. So that reminds me of one of the studies that I was reading about just like that there's that reciprocal relationship between the movement and speech and language. So, and it might be that you just have to kind of mix it up. Um, you know, TH and loves to spin and jump. Mm-hmm. Yeah, I like that, Sabrina. I like that idea of setting up a mini obstacles course. Yep, great idea. Yep, because then you can incorporate all like spinning, jumping, and running. Mm-hmm. Oh, oh, that's cool. Yeah, even like a scavenger hunt. That's so cool. Love that. Mm-hmm. Yeah, or making the book interactive. Mm-hmm. Yeah, love it. Okay, I know we're kind of getting close to the end of our time. Do you guys have any questions or anything for me? Let me see. There's oh, that's cool. A sensory box. Yeah. I love it. See, I love being able to have a look, some of this collaborative time. I think sometimes, we can feel so isolated in whatever setting we're in, and trying to come up with things, but being able to actually just like have that time to be able to hear from other people, like ideas of what we can do is just really helpful. Mm-hmm. Yeah, I like that, Melissa. Mm-hmm. So taking that character and really expanding on it. Yeah, I've found that like he'll cry and reach for the book. Yeah, there's something. Mm-hmm. Yeah, a lot of great ideas. Trying sometimes it's just figuring out you can try different things and see what ends up working. Okay, so I think we'll end here, guys. Let me see. Yeah, it doesn't look like you guys have a lot of questions, so let me go back here. Okay, Jim, if you want to take over from here.
All right. Thank you, Ruth, for sharing your knowledge and expertise with us. For those of you still here, if you would like to earn ASHA CEUs for today's session, please remember to complete that assessment. You will be directed to a post-session page when the webinar closes. You'll have a link to the assessment there. You'll have to pass that assessment at 80% or better, and that assessment will be open for 1 week. You'll also receive a post-session link in the email that will come tomorrow, 24 hours from the start time of today's session. Thank you everyone for attending, and have a great day.